Hello and welcome back to the channel. Thank you guys so much for commenting, for liking, for viewing, for subscribing. I am very happy. I'm very glad with the responses to these videos. It has given me more, zeal to try and make more videos and try and get more information out there. Thank you guys so much. And for those of you who are just joining us on this channel, my name is Janice. I am a healthcare provider. I have been for over 13 years. I started off as a home health aide and I made my way to a RN, BSN, MSN to now a family nurse practitioner. However, I'm still practicing as a RN. I am a travel nurse and I'm locked into a couple of contracts. So once I'm done with my contracts, I'm going to transition into my position as a family nurse practitioner. So this channels cover everything nursing. How to pass nursing school, how to get into nursing school, how to survive nursing school. We talk about nurse bullying. We talk about current events that are currently affecting the healthcare industry. And we talk about opportunities within the healthcare industries. And we're also going to see me make my way from bedside nursing to a provider. So stay with me. Comment, like, and subscribe. Join this community. And you're going to get tons of information because I'm sharing every information that I wished somebody had told me when I started. I love to see people win, and I'm trying to put that information out there to help my healthcare providers get going and be accomplished. So today I'm going to cover how to get started in nursing school, how to start nursing school. So this topic came about because I had a conversation with one of my patient's daughter. She came up with my patient and I was the admitting nurse on the floor. So while doing my admissions, she asked me, how does it feel like to be a nurse? Of course, I answered. And she said, I'm thinking about going to nursing school, but I'm not sure if that's the path I want to take. Like, I'm not 100% sure, but I would really like to be a healthcare provider. But I think it's really hard. And some things, sometimes I feel like I cannot do it. So I gave her some advice. Of course, I didn't have the time to give her a whole lecture, but I did give her some advice and she said she's gonna take it and use it. So they got me thinking, make this video and put that out there and show people the different pathways that they can take to become a nurse or a nurse practitioner. And especially for those who want to do it, but they are not sure that they're able to provide that patient care. Let them start from somewhere and make that way up. So that's what this video is about. Starting from the lowest and going, not the lowest, but starting from a lower position and making your way up to a higher position. So for those of you who've been here with me on the channel, and I stated earlier, I started off as a home health aide. So I'm gonna tell you the path to make your way up. If you are not fully 100% ready, or you don't feel like you can provide care for a patient and you want to experience how it's like before jumping into becoming a registered nurse, start off as a home health aide. To become a home health aide, you have to get trained for about 3 weeks. Now, you can find these training sites through the jobs. If you're looking for jobs to start as a home health aide, some of these agencies, they train their home health aide for free. So you can start from there. It takes 3 weeks to a month. They take you through. You even go to a little clinical in a nursing home or hospital, depending on what the agency's connections are. And you start to work as a home health aide. When you start, you're providing care for patients on a one-to-one basis, meaning that you're going into the patient's home and you are providing care for them. You're not doing anything clinical. You are supervising them throughout the days to make sure that they don't fall, to make sure that they shower, to make sure that they eat their lunch, their dinner. And you can spend anywhere between 4 to 24 hours. There are some home health aides who have a 24-hour cases with the patients, especially those patients who don't have any family member and are critically ill, and you have to be there to help them out throughout the day. So you can take care of one patient at a time. You get that experience to see how it is to be with a patient, to care for a patient. Now you are not administering their medications to them, but you are reminding them to take their medications. So that's a home health aide. And you can get the experience of multiple patients within the home health aide settings. Let's say this week you have a patient that you care for. The next week, the agency might assign you to another patient's home to care for. Now, that is very important, and I wish that some of you would take the time to experience the variety of the patients, because you're going to go into a home to a patient and they are so sweet. You sit and watch their favorite movies with them, you chat with them, you help them out, and it's really great. And you're thinking, yes, I can do this. This is what patient care is. I can definitely do it. But then the next week, when you go into another patient's house, they are so grumpy. From the moment you come into the door, they are verbally, abusive. And those are those patients who have Alzheimer's, dementia, and they are running out of the house, and you have to chase them to bring them in. They don't want you to be there. Those are the patients who are considered difficult, and you get to experience that, because it is not always going to be those very, very sweet patients when you become an RN. There's going to be patients that is jumping out of the room and you're running behind them while you're providing care. Some of them are trying to hit you. Some of them are verbally abusing you. I'm not trying to scare you off. I just need to be as brutally honest with you as I can, so that you can know what you're getting into. Okay? It's important. I'm not going to sit here and try to lie to you and say, oh, every patient is, no, it is not. It is not. So you get that experience. So let's say if you're a person and you don't want to go into the patient's home to provide care for them, become a CNA. The CNAs, they train for about 3 months. And after that, they are certified to work within the nursing home settings and within the hospital settings. Some of the hospitals call them techs, but other places they refer as CNAs. It all depends the hospital preference. And you work with multiple patients. So now you have graduated. You are not working with just one-to-one patients. You have multiple patients to care for. Let's say you can start for about 4 patients to up to 6 to up to 8, depending on the area in which you are working. So now you are taking blood pressure for these patients. You are taking their blood glucose. You are helping to change them. You're helping the RN on a one-to-one basis, like to help these patients within the nursing home, hospital, or assisted living area. So while you are there as a CNA, you can observe the RN's work. You can observe the LPN's work, and you can decide if that's something that you want to do to go further. At that moment, take the time to get a mentor, an RN mentor, LPN mentor, and ask them questions, and they can let you know how their day-to-day text is like. Some of them will be brutally honest with you, and they will let you know how it's like. So if you're going through the process of a CNA and you feel like you want to go further, you can go further to becoming an LPN. The LPNs, they go to school for a period of 1 year, and they get their license. The LPN have to take a state board also. They get their license and they start to work. The primary job of the LPN is to administer medications to the patients. The majority of the times, the LPN works within the group home settings, the nursing home settings, the assisted living settings. There are some hospitals also who employ LPNs to administer medications. So they give medications and they do wound care. However, they are not doing any physical assessment. The physical assessment are for the RNs. So when you make your way up to the LPN and you have been observing the RN and you feel like you want to go further, you can go ahead and get your RN. And that should take you from the transition from an LPN to an RN. It should take you about 1.5 years. Now, that's depending on the program that you are going to and the requirement for those programs. So you can go ahead and become an RN. Now you are combining patient care, you are combining medication administration, so you are combining physical assessment, everything. Now you have become an RN and you have already had experiences in patient care. So it's definitely going to help you out. You're going to be that student in clinical where you like, wait, I can do this, helping to change the patient, helping to talk to the patients, and other students who have absolutely no experience in any of this area gonna be looking at you like, oh my gosh, she knows everything, and she's still a nursing student. So it definitely helps when you get that experience and start from home health aide or CNA or LPN, make your way up to a RN. And of course, you can go for an RN and get your BSN in nursing. The BSN is a continuation of education. It helps you to improve in your quality of patient care. It helps you to know how to do evidence-based practice research that is used to improve the patient care. So that's what a bachelor's degree is. And once you get your bachelor's degree, you are able to earn more. You are able to work in other places, maybe get into management, because there are some hospital or some nursing home who will hire you with a bachelor's degree to be a manager on the floor. And if you are doing good in that and you can, go ahead and get your master's. You can transition into management also. And then if that's good for you, go ahead and get your family nurse practitioner and your doctorate degree in nursing. So nursing goes all the way up to a doctorate degree. You can work your way up. It takes years. It's not a snap of a finger thing. It takes years, but you can definitely do it. I took my steps and I was able to get to where I am now. I'm still in the path of moving upward to get my DMP, but I just want to transition as a FNP right now and make my way up and, get more relaxed and see what else I want to do. So that's the path that you can take. And very, very important. Choosing nursing school is very important. We all know that nursing school is very expensive. In most cases, you have to take a loan to get your registered nurse. Especially sometimes you are able to get financial aid. For me, I was able to get financial aid to get my registered nurse degree. I didn't have to pay any loan. And then after, when I started to get my bachelor's, that's when I had to take out a loan. I got partial financial aid and partial loans. So do your research within your states. Google. Search your state website on financial aids for school. Search for schools in your community, in your state, in your nearby states. But one thing I need you to do is make sure that your nursing school that you select is accredited. Being accredited, a school being accredited means that the state and the State Board of Nursing have approved that school curriculum, that the curriculum of that school meets the standard of the RN. So any school you're going to get your LPN, your RN, your MSN, your BSN, your family nurse practitioner, make sure that they are accredited. Because if they are not accredited, nothing you're doing in there is valid. You are not going to be able to move on and take your state book. There are some schools, when you contact them to start, they're going to tell you, oh, we are not fully accredited. However, we are working on our accreditation to start. Don't do it. Run with your money or run with your loan and go find another school that is accredited. So you will always see on the school website accredited, or Google the state to make sure the school is accredited. You don't want to be part of a students that start a nursing school and you realize your school is not accredited. And also make sure that you keep update with the school to make sure that they uphold to their accreditation, because there are some schools who are losing their accreditation and the state is not recognizing them as a nursing school anymore. And those students are left hanging and they are not able to graduate and take their state board to pass. So those are the paths that you can take to become a nurse, of a family nurse practitioner or doctoral of nursing or nursing degree. It is not going to be a quick thing to do, but it is a process, and it is not going to be so easy every day. There are going to be an easy day, there are going to be a stressful days. So, but you can absolutely do it. That's my encouragement to you. And if you are a person and you are 100% sure that's what you want to do, go ahead, get enrolled into RN school, find a school, take your prerequisites, and get into the school and go straight as a RN. And if you don't have to work while going to nursing school, don't do it. Use your resources. If you have a family member, a husband, a boyfriend, a father, a mother, family member who are waiting to work and see you through nursing school, take that opportunity and go to nursing school. If you don't have to work, don't put that stress on yourself. It is okay. Other of us don't have to work. I had to work in nursing school throughout my career path and into getting my family nurse practitioner. But if you're a person and you don't have to, take that opportunity and use it, so that when you graduate, you can be able to, help that person out who helped you out and let you go to school. It is very important to use your resources. If you have them, use them. But if you need to go to nursing school and you need to start from a home health aide or CNA, LP, and make your way up, it's okay, do it. That way you're able to work, save up some money, and go up to the next step to be able to help you pay for the next step. So I hope these information will be able to help you get started. All right, if you have any question, leave a comment below, let me know, and we can go ahead and talk about it. And if you are in your journey and you started another way, you feel like you want to let us know about it, comment below, let's talk about it. Please, if you like this video, this information being put out, please comment, like, and hit the subscribe button. It's the button right there, thing. Hit the subscribe button and hit the notification button so when I post a video, you can get it on time and get this very important information. Share this information with your children, your brothers and sisters, aunties, nephew. Everybody's going to nursing school. The age don't matter. Give this information to somebody who needs it. All right? We can definitely do it. I am a poster child of you can do it. So thank you all for staying with me. Thank you all for watching, and I see you in another video. Thank you, and bye for now.